So it is very, very nice to meet you and see you. I am so very excited to be with you and spend with you the next hour. Today we are going to speak about acne. If you have any question, you can write it on the chat and I will refer to it in the end. So let's start. Okay, so we are going to talk today about in acne, the definition and pathogenesis of acne, the treatments, home care and in clinic, medical treatments, and a bit about post-acne treatments. What can we do after the acne? So when we look at acne, we actually treat symptoms. We see and we treat the symptoms from the outside, but actually it's not the source of the acne. It's not the source of the disease of the skin condition, because the source is from the inside, is from our bloodstream. We actually see what we see is a multifactorial skin disease of the polysebaceous unit that involves infection and develops to blockage of the skin disease and hair follicle. But this is not the real source. The source is the change in androgen levels in our bloodstream. I just want to renew about the polysebaceous gland anatomy. You can see from the left, this is a normal state. You can see here the sebaceous gland and the duct that combines it with the hair follicle. Here from the right, actually it's bigger and maybe, oh, sorry. It's easier to see is where the sebum is being secreted from the gland, goes up through the duct and goes up and out from the skin. When we have a lot of sebum, it will be a kind of, it will be an oily skin, you know, the shiny people, because they have a lot of sebum. If there is a smaller amount of sebum, it will be a dry skin. And this is the normal state. This is how it looks like. The sebum is going out from here naturally. We also have in the polysebaceous unit microorganisms that live there naturally. We have the P. acne, we have the Staphylococcus aureus, and the streptococcus. If you had pharyngitis, I hope you didn't, but if you did, this is the kind of bacteria that also do the pharyngitis. Okay. So now we go a bit deeper and talk about the acne pathogenesis. Why does it happen? So acne is caused by appearance of androgen in our bloodstream when testosterone changes and become dehydrotestosterone, and in this way he goes to the bloodstream. As a result for this change, there is a few changes. This change in hormones can happen in our teen years from a few reasons. It can happen in our teen years, changing hormones, genetics, and even from certain medication. When it happens, it affects a few things on our body. First, the sebaceous gland size can be increased, and there is irregular keratinization that clogs the pathway for the sebum, and secretion comedone are being created. This is how comedone is being created. This is the first stage of acne. It calls acne comedonica. The second stage is when this happened, and we also have inflammation. This kind of acne calls, when we have inflammation, it calls acne papulopustulosa, and it has 3 different levels: mild, moderate, and severe. The third part, and the harshest, is when with the inflammation, we also have bacterial infection. And this kind of acne, we call it acne conglobata. You can see it in the drawing beneath that we have the healthy hair follicle. In the start, we have the white and black heads, which we call the comedones in acne comedonica. And after, with inflammation, there is more sebum, and we will see papules and pustules. And I will tell them more about them a bit later. Stay tuned. Okay, so now that we know the pathogenesis, let's look at the lesions. This is the first lesion of the comedones. We can see the hair follicle that we know already. The sebum is coming up from here, and because of the keratinization, it stucks. It clogs here, and it can go out, what happens naturally. So this is a comedone. Nice to meet you. We see the sebum is stuck and it can't go out. This is what we call a whitehead. The next one underneath, we call it a blackhead. It calls an open comedone because the sebum is here, but it's stuck. It can't get out because of keratinization, but some of it did go out, and as he got into oxygen, he became black. He got his black color. And this is the only difference between black comedone and blackhead and whitehead comedone. So let's talk a bit on acne comedonica. You can see here, this is the blackheads and this is whiteheads. Acne comedonica is a form of non-inflammatory acne, which is made of primarily blackheads. In this stage, there is no inflammation at all. The acidity of the skin is still normal. It will be between 4.8 to 5.5, which is normal. It's important because the acidity of the skin it's one of the skin's protections. When it changes, it affects on how we protect the skin, how much can we protect on it. When the acidity is high, there is no protection, and there will be a lot of bacteria thrives. But I'll refer to it again later. So what we have in acne comedonica, first, before I start and talk about what we have here, it's very important to know that when we treat acne, it's important to cover up all the symptoms that we have. Because if we won't cover all of them, we can go back and don't get the best result. So here I have only 2 symptoms, as you can see. The first one is increased sebum secretion, as we saw that happens in comedones creation. And the second, we treat it by using retinoids or niacinamide. The second symptom is hyperkeratosis and comedone formation. We can treat it by using kinds of acid like alpha and beta hydroxic, azelaic acid, and pyruvic acid. So now we will see where do we have these ingredients in the products. First, we have the acne solution. Here in Israel, when I go to my clients, I call him Little Magic because he's wonderful. What we have here in the acne solution is first 4% of niacinamide. Niacinamide is a provitamin that helps us to decrease sebum secretion, and also he can work on the skin, effect on the skin for the long term, which is very, very important, that the skin won't get used to it, that he won't be resistant for it. The second ingredient you see here is a 30% of perfluorocarbon emulsion, an oxygen carrier. As you know or don't know, the P. acne is an anaerobic bacteria, and when he meets oxygen, he can't thrive. It just stops. It prohibits him from thriving and develop colons. So also it helps us against P. acne. The third one is oligopeptide 10, which is, it has a very, very, very good exhibit against the P. acne bacterium thrive, and he can also replace antibiotics. For the long term, our body, our skin doesn't get resistant to it. And last but not least, we have the Avenia sativa extract, which is actually wild oats. This is the name that most of the people know. It has anti-inflammatory. He is anti-inflammatory. We have one more product that we need to use if we want to cover all symptoms, because till now we only covered the secretion of sebum. So in order to fight against the hyperkeratosis, we can use intensive hydrogel because it contains two kinds of acid, alpha hydroxy and beta hydroxy. The alpha hydroxy is lactic acid that removes the dead skin cells from the top of the hair follicle. It just helps to open it. And the other is 2% of salicylic acid that has antibacterial properties. It also helps us to rejuvenate the skin. So in this way, we have covered the whole two symptoms we have in acne comedonica. But what happens if I have like many comedones? So if I have many comedones, I can add onto it a retinoid. If I have no inflammation, I can use acne solution and intensive hydrogel, and at night give a retinol charisma 1%. But if I do have inflammation, I won't do it, and it won't be comedonica. If it's a comedonica and there is many comedones, like you saw in the picture in the beginning, I can add also retinol that will help me. And if the skin is very red or aroused, I can use the ampoules because they very relaxing and soothing the skin. Of course, in the beginning for soap, I will use the sea cleanser, or now we also have the Cosmo Clear. And that's it for that's about it for the products in acne comedonica. We apply the products, the acne solution and intensive hydrogel twice a day, in the morning and even in the evening. And if necessary, we can also apply the acne solution even more in the middle of the day, transparent, and it can help to reduce the sebum and clear the face, stay with clear face. Okay, so let's move on to the second stage. I said there is three. One is behind us, there is two more. Let's talk a bit about acne papulopustulosa. This is an inflammatory form of acne, a typically mixture of comedones, papules, and pustules. Comedones, we know them already, we just spoke about them. Papules are small red wound, and if we see it, we don't drain them, we don't touch it, we will just give the patient material products at home. I won't touch it and try to drain them because the inflammation might spill and be all over the skin and do damage instead helping. If I see pustules like you see in the picture, I can try and drain them very, very, very gently, and I can drain them very, very gently. Okay, there are three main stages to acne papulopustulosa. The first one is mild, second is moderate, and the third one is severe. And of course, now we will talk about them. So let's talk about symptoms first. As you can see, now I have more symptoms. I have 4, not only 2. In acne papulopustulosa, we have 4 symptoms: the increased sebum secretion and follicle hyperkeratosis that we have just known, and add on top of it, we have bacterial infection of P. acne, streptococcus, and staphylococcus. We can treat it by the next ingredients. You can see we can treat it by 20% of azelaic acid, niacinamide, perfluorocarbon emulsion that we've already know, also the niacinamide we saw in the acne solution, oligopeptide 10 that we saw, alpha and beta hydroxy like in hydrogel, and pyruvic acid. And the 4th symptom that I have to cover up is botanical extras and propolis that I have in the ampoules and the acne solution. So let's go over and see the products. How can we really do it? First, I would like to add and explain a few words about azelaic acid. Azelaic acid is what we call like a perfect drug, because from one hand, she's very, very, very potent. She has many properties, and from the other end, she is very, very safe for use. She has keratolic activity, antibacterial, anti-androgenous, sorry, anti-inflammatory. She can work and give a very, very good cover to the skin for 12 hours. She is allowed to be used by also pregnant women. She is not photosensitive, which is important, and also she doesn't arouse the skin thanks to the DermShield, which is very, very important, especially in acne, because many acne patients have sensitive skin. So this is about the azelaic. We can see the azelaic acid in 2 products in different concentration, and I'll show you now where we can see it. Sorry. Okay. First, we can see it in the double fight. The double fight is actually one product that combine two products in it. First, the A, it's the hydrogel, 10% of lactic acid plus 2% of salicylic. We saw him before in the Comedonica. The second, the B, is 20% of azelaic acid and 5% of alpha-butene. This what help us first to treat the inflammation, and also together they brighten the skin and help us to fight about the acne, the post-acne in the future. So this is what we have here. I will use the double fight in acne in mild to moderate cases. It can be very, very, very helpful. The second product we will see the azelaic acid is in harsher cases. It calls azelaic forte 25 because it contains azelaic forte that in 25%, not 20, but 25. it's a bit more concentrated. It also has here the alpha-arbutin, and I will use it when I have acne papulopustulosa in like moderate to harsh cases. I will combine it, of course, with the intensive hydrogel and, of course, the acne solution. Okay. Also, when I have harsh cases, I can use retinol. I can use retinol in two different cases. First is the acne comedonica, where I have many comedones, and I want to reduce the sebum secretion. Also, I can use it in harsh cases, but not in the beginning, not when I have inflammation, because if there is inflammation, the retinol can arouse the skin and it will be very unpleasant to the patient. So I will wait till I overcome the inflammation, and then I add the retinol. The retinol is also, he can reduce the sebum secretion, and also he rejuvenates the skin. There is one more purpose to the retinol, one more situation I like to use retinol. When the hair follicle is not straight, sometimes the hair follicle can be curly, and this can cause inflammation. So retinol will be the only ingredient that will help the hair follicle get straight, and it can help many times when there is acne. So many times I ask my clients, do you see the sebum comes in a straight way or curly hair? And then I know if there is a problem with the structure of the hair follicle. If it goes out, the sebum goes out while they drain it in a curly way, I know I have to give retinol, and it should be useful in these cases. Okay, so I think we cover all up the acne papulopustulosa. We'll go, oh, I'm sorry. We also have the acne complex, the ampoules that contains a lot, so many good soothing and relaxing ingredients, like 6% of niacinamide, which is anti-inflammatory. Also, the dipotassium glycyrrhizide is anti-inflammatory and really relax and soothes the skin. The botanical extracts are very good. They really help the ampoules. Like I can use them in any kind of acne in every state, and they will help to relax the skin and give like a boost to the treatment. Okay, so last but not least, we have the acne conglobata. As you can see in the picture, it's harsh, it's very inflammatic, it's multiple inflamed blemishes of papules and pustules, and they group together to cyst, and it can be even very painful to the patient. Sometimes the patient can even get steroids from a doctor just to relieve the pain. In this case, we must have also medical intervention, but we combine our products with the medical intervention. So in these cases, of course, I will always choose like the strongest product that I have. It will always be Azelaic Forte, intensive hydrogel. I guess I will need to add on also the retinol and the ampoules, because it's very harsh. So I said medical treatments. I guess we should know what kind of medical treatments we have. So first we have the antibiotics. By using antibiotics, we actually reduce the bacteria population, the sebum secretion, and the inflammation. I can use antibiotic and also our products. We can do it and we should do it, because when we use antibiotics, after 1 or 2 months, our skin gets resistant to it, and we just be stuck. So if we start, or if we use the products by the antibiotics, we actually prepare the skin and reduce the acidity of it. And when he will get resistant, there will be a good environment, good acidic environment where bacteria won't be able to thrive thanks to the acids. The next treatment we have is retinoids. It can be azotertinone or Roaccutane. In this case, if the patient gets Roaccutane, we won't give him any active ingredients. We mustn't give it to him because it's too harsh. The Roaccutane dries the sebaceous unit, and we can do it, but we can give him complementary products like Igloo Moist or Acne Complex. Things like this will really help him next to the Roaccutane. And the third treatment is the birth control pills that reduce the androgen level in the blood and reduce the androgen effect. Okay, so this is about the home care. Now let's talk about in-clinic products, in-clinic treatment. And before I get to the products itself, it's very important for me to say that it's really important to keep about the timing of the clinic treatments, because if we do treat with acne, we won't get the patient, it's not us, it's the patient. If he won't get to clinic on time as he should, we won't be able to move on and get the result we can get. So the esthetician must know it comes together, clinic and home care. Sorry, I have just to zip a bit, just a minute. Sorry, thank you. When we get to clinic, how often we get to the clinic, it depends on the acne severity, and it's written on the protocol guidebook for each case, how often should the treatment in clinic should be done. There is a recommendation. So now after I spoke and talked so much, let's see what we do in the clinic in acne. First of all, every treatment in the clinic, we start, of course, with washing our face with the Cosmo Clear or the Sea Cleanser. Afterwards, we will put the prep-peel, and we can apply. So we can apply the G-peel for 3 minutes. Okay, we apply it for 3 minutes only because I want it to be able. It actually it prepares the skin to the drains. So it opens it softens it also makes exfoliation to the skin. And the G-peel 50, as you see, he is every kind of skin. You can use it on every kind of skin, even sensitive skin. If the client doesn't have sensitive skin, I can use the G-peel 50 nano-constructed gel. Again, it's a glycolic acid, 50% as well, but because of the nano-constructed technology, it equals to glycolic acid like 60 to 65%. It's very good for oily skin, but only if he is not resistant. Only if he is resistant, I'm sorry. Okay, I apply it as well for 3 minutes and then neutralize it. The second stage will be the cleaning and drying of the face with thermogel. And afterwards, after I wash the face again, we'll use the acne complex to relax the skin, to have the skin a lot of anti-inflammatory products to soothe it, and decrease the redness and decrease the bacterial proliferation. The next step, on top of the acne complex, I will put the Mediclay mask. The Mediclay is purifying problematic skin, soothes the redness, reduce bacterial proliferation. Okay, and in the end, after I clean the mask, I wash it off. I will put a very, very, very thin layer of SPIL, salicylic acid 20%, that has a very good antibacterial properties. And it also softens the sebum in a very, very good way. We also always tell to put it and just put a UVB sun protection on it, and don't wash the face for at least 6 hours. The patient can even sleep with it, it's okay, the more the better. And when he gets up in the morning or after 6 hours, just wash the face and continue with home care treatment when the face relaxes from the treatment. I say now let's talk about, before I spoke so much about the treatment, but there is one thing that we must do before the treatment, and this is the grading the acne, so we can know by ourselves how can we treat acne. This grading you can see in the guidebook of protocols. What we actually do here is we count how many comedones, how many papules, and how many pustules there is. We sum it all up, and then we can understand what kind of acne is there, if it's mild, moderate, or harsh, or severe. We go to the right protocol in the guidebook, and then we know first how to treat in the right way in the clinic, and also what are the best products to give to the patient at home. Okay, so I promised a few words about post-acne. After we treated acne and we had such a wonderful and great result, sometimes there is a discolorization on the skin that follows the inflammatory wound. It will be flat. There will be no inflammatory. It happens in every kind of skin and in every color. And it can cause hyperpigmentation or scars or redness also. And it stays exactly where the wound were and doesn't go anywhere. What we can do to treat it is first keep on with preventing treatment to reduce sebum secretion. Also, we can use anti-inflammatory products like Igloo Moist, Acne Complex, Mediclay Mask, and antioxidants like Vici Serum and azelaic acid. We will be concentrated on the products that help the skin to heal and to have overcome its situation. I'm sorry, I'm still excited. And of course, we can continue with the in-clinic treatments, and we can use in this case the pyruvic acid that helps to rejuvenate the skin in a very, very, very good way. So before we before I finish, I wanted to show you a few cases, a before and after, to show the results with NOON products, of course. You can see here a young woman that has a moderate acne papulopustulosa. At home, she got only 2 products. She got the double fight that contains the hydrogel and azelaic acid and the acne solution for the sebum secretion. And she was treated also in the clinic. And you can see by yourself the result after 6 months. The next patient I picked was also a young lady with harsher, with severe acne. You can see the big wounds, so full of inflammation. And this is the reason that this patient got also retinol charisma 1% and acne complex and acne solution, of course, and the double fight. We needed the retinol to handle, also to reduce the post-acne and to handle the sebum secretion. She used these products at home daily, combined with in-clinic treatment. And you can see by yourself the beautiful result after only 12 weeks. When I saw the first picture, the before, I was positive she will have scars. But look at the skin, he looks very, very beautiful after using the products. Well, my favorite, I must say, is a boy, a young boy, looks like so nice, that has, it's moderate, between moderate to severe acne papulopustulosa. He got for treatment, of course, the C cleanser. He got the double fight, the A and B. Also, for the evening, he got the azelaic forte to give him like a bit of a boost for the anti-inflammatory because he had so many wounds and so much inflammation. The acne solution and the acne complex, because you can see by yourself, his face is very, very aroused and very, very red. So this is what he got, of course, with combining with in-clinic treatments. And this is the result after 7 weeks only. It's less than 2 months. And look at the skin, is straight, is clean, almost clean, almost totally clean. So I really love this case. So this is for all for today.